Basal cell carcinoma. Basal cell carcinoma is a kind of skin malignancy. Basal cell carcinoma starts in the basal cells, a kind of cell inside the skin that produces new skin cells as old ones vanish. Basal cell carcinoma regularly shows up as a marginally straightforward knock on the skin, however it can take different structures. Basal cell carcinoma happens regularly on spaces of the skin that are presented to the sun, like your head and neck. Most basal cell carcinomas are believed to be brought about by long-haul openness to bright, UV radiation from daylight. Staying away from the sun and utilizing sunscreen may help ensure against basal cell carcinoma. Manifestations. Basal cell carcinoma generally creates on sun-uncovered pieces of your body, particularly your head and neck. Less frequently, basal cell carcinoma can create on pieces of your body generally shielded from the sun, like the private parts. Basal cell carcinoma shows up as an adjustment of the skin, for example, a development or an irritated that will not mend. These progressions in the skin, sores, as a rule have one of the accompanying attributes. A silvery white, skin-hued or pink knock that is clear, which means you can see somewhat through the surface. Minuscule veins are regularly apparent. In individuals with more obscure skin tones, the injury might be hazier yet to some degree clear. The most widely recognized kind of basal cell carcinoma, this sore regularly shows up on the face and ears. The sore may break, drain and scab over. A brown, dark or blue sore, or an injury with dim spots, with a somewhat raised, clear boundary. A level, flaky, rosy fix with a raised edge is more normal on the back or chest. After some time, these patches can become very enormous. A white, waxy, scar-like injury without an obviously characterized line, called morpheoform basal cell carcinoma, is the most unnormal. When to see a specialist? Cause a meeting with your PCP in the event that you do notice changes in the presence of your skin, like another development, an adjustment of a past development or a repetitive sore. Causes. Basal cell carcinoma happens when one of the skin's basal cells fosters a change in its DNA. Basal cells are found at the lower part of the epidermis, the peripheral layer of skin. Basal cells produce new skin cells. As new skin cells are created, they push more established cells toward the skin surface, where the old cells kick the bucket and are sloughed off. The way toward making new skin cells is constrained by a basal cell's DNA. The DNA contains the guidelines that instruct a cell. The change advises the basal cell to increase quickly and keep developing when it would typically kick the bucket. In the long run, the amassing unusual cells may shape a carcinogenic tumor, the sore that shows up on the skin. Bright light and different causes. A significant part of the harm to DNA in basal cells is thought to result from bright, UV radiation found in daylight and in business tanning lights and tanning beds. In any case, sun openness doesn't clarify skin tumors that create on skin not usually presented to daylight. Different variables can add to the danger and improvement of basal cell carcinoma, and the specific reason may sometimes not be clear. Risk factors. Variables that expansion your danger of basal cell carcinoma include constant sun openness. A ton of time spent in the sun, or in business tanning beds, builds the danger of basal cell carcinoma. The danger is more prominent on the off chance that you live in a bright or high-height area, the two of which open you to more UV radiation. Extreme burns from the sun likewise increment your danger. Radiation treatment. Radiation treatment to treat skin inflammation or other skin conditions may expand the danger of basal cell carcinoma at past therapy locales on the skin. Light complexion. The danger of basal cell carcinoma is higher among individuals who spot or consume effectively or who have fair complexion, red or fair hair, or light-shaded eyes. Expanding age. Since basal cell carcinoma frequently requires a long time to create, most of basal cell carcinomas happen in more established grown-ups. In any case, it can likewise influence more youthful grown-ups and is getting more normal in individuals in their 20s and 30s. An individual or family background of skin malignant growth. On the off chance that you've had basal cell carcinoma at least multiple times, you have a decent shot at creating it once more. On the off chance that you have a family background of skin malignancy, you may have an expanded danger of creating basal cell carcinoma. Safe stifling medications. Taking meds that stifle your invulnerable framework, for example, Hostile to dismissal drugs utilized after relocate a medical procedure. Altogether builds your danger of skin malignant growth. Openness to arsenic. Arsenic, a harmful metal that is discovered generally in the climate, expands the danger of basal cell carcinoma and different diseases. Everybody has some arsenic openness since it happens normally. However, a few group may have higher openness on the off chance that they drink defiled well water or have some work that includes delivering or utilizing arsenic. Acquired disorders that cause skin malignant growth. Certain uncommon hereditary illnesses can expand the danger of basal cell carcinoma, including nevoid basal cell carcinoma disorder, Gorlin-Goltz condition, and xeroderma pigmentosum. Entanglements. Complexities of basal cell carcinoma can include a danger of repeat. Basal cell carcinomas normally repeat, even after effective treatment. An expanded danger of different kinds of skin malignant growth. A background marked by basal cell carcinoma may likewise build the shot at creating different sorts of skin malignant growth, for example, squamous cell carcinoma. Disease that spreads past the skin. Infrequently, basal cell carcinoma can spread, metastasize, to close lymph hubs and different spaces of the body, like the bones and lungs. Counteraction. To lessen your danger of basal cell carcinoma you can stay away from the sun during the center of the day. In numerous spots, the sun's beams are most grounded between around 10 a.m. also. 4 p.m. timetable outside exercises for different times, in any event, during winter or when the sky is overcast. Wear sunscreen all year. Utilize a wide-range sunscreen with a SPF of something like 30, even on overcast days. Apply sunscreen liberally and reapply at regular intervals, or all the more frequently in case you're swimming or sweating. Wear defensive apparel. Cover your skin with dim, firmly woven attire that covers your arms and legs, and a wide overflowed cap, which gives more insurance than does a baseball cap or visor. A few organizations likewise sell defensive attire. A dermatologist can suggest a fitting brand. Remember shades. Search for those that block the two kinds of UV radiation, UVA and UVB beams. Try not to tan beds. Tanning beds transmit UV beams and can build your danger of skin disease. Check your skin consistently and report changes to your PCP. Inspect your skin regularly for new skin developments or changes in existing moles, spots, knocks and pigmentations. With the assistance of mirrors, check your face, neck, ears and scalp. Analyze your chest and trunk and the tops and undersides of your arms and hands. Inspect both the front and the rear of your legs and your feet, including the bottoms and the spaces between your toes. Likewise check your genital region and between your hindquarters.